We know that faith communities are found throughout the world, and so we've been working with faith communities who are willing to provide trauma-informed community care within their own context and region. I'm going to be presenting about this work today, which is called Triumph Over Trauma, and is a website that we will share with you that provides content, curriculum, and online training for people globally. We know that weapons of war are held by nations, but we also know that weapons of mass destruction are also held now by individuals the world over. We know that what drives people to use them comes from a variety of reasons. Do people understand their capacity for darkness? Do people understand their capacity for good? This is what this work looks at. Faith communities are found globally in the midst of suffering and in the midst of violence. Sometimes they are the instigators of violence, unfortunately. Most times they are filled with people who care about providing resources and love to one another and their neighbors. We know that when societal violence occurs, people often turn to houses of prayer for consolation and to find renewed hope. There are three ways that we see faith communities currently providing resources in the midst of violence. One, they provide social connection that reduce isolation and loneliness in the midst of anguish. They often serve as alternatives where there are no psychologists or psychiatrists or access and affordability to them. And we know also that many times faith communities serve as locations where families are actually reunified post mass shootings or other disasters. In the Eastern Democratic Republic of Congo, the Mama Lynn Center was built to provide access for those who had suffered from sexual violence during their conflict and war. The United Methodist Church envisioned building a center where people who are survivors could go to in order to find renewed hope, learn new skills, and find community. When I was involved in helping to build this center called the Mama Lynn Center there, I was asked by people in Nigeria, Uganda, Kenya, the US, and the Philippines if I would help them build similar centers. I am not a building builder. I am one who seeks programs that can help people in their own context. And so I began looking for an online program that was already developed and proven effective that could help people help others in wise ways. Online, through Google search, I found the National Association of State Mental Health Program Directors. Their programs have been in use for over 20 years, beginning with a women's prison here in the United States, and then flourishing in other contexts, such as psych units, homeless programs, and other community-driven programs. Their program called TAMR, which stands for Trauma, Addiction, Mental Health, and Recovery, is one that is a psychological education-oriented program that helps people identify their own triggers and trigger responses, and then better self-soothe in healthy ways. I teamed up with NASMHPD, the National Association, so that we could offer their programs into houses of prayer. In 2021, we offered our first online training and had 10 countries represented. As part of these 10 countries, we had people from a variety of contexts, whether it was from a gender-based violence context,